The Trump administration's approach to health care is setting off alarm bells. The Centers for Disease Control and Prevention will expand research into the repeatedly debunked link between autism and vaccines. Remember, the CDC is under the umbrella of the Department of Health and Human Services that is now led by Robert F. Kennedy Jr. Kennedy rose to prominence as an anti-vaccine crusader and has claimed without evidence that childhood immunizations are linked to autism. Meanwhile, there are now measles cases in at least 13 states, including Maryland, where a case was just confirmed in a resident who returned from international travel through Dulles International Airport earlier this week. The disease has already killed 2 people, including a 6-year-old child in Texas. These mark the first deaths from measles in the United States in a decade. Both were unvaccinated. It's important to note that according to the CDC, the vaccine to prevent measles is 97% effective. Instead of urging Americans to get vaccinated, the Secretary of Health and Human Services wrote in an op-ed for Fox News, quote, "The decision to vaccinate is a personal one." Not only that, Secretary Kennedy is also pushing vitamins, cod liver oil, and steroids as a method of prevention and treatment.
Right now, we have we're delivering vitamin A. We are providing assistance if people need ambulance rides, and they're getting very, very good results. They report from budesonide, which is a steroid. It's a 30-year-old steroid, and clarithromycin, and also cod liver oil, which has high concentrations of vitamin A and vitamin D.
Joining me now, Dr. Ashish Jha, Dean of the Brown University School of Public Health and a former White House COVID-19 response coordinator. Dr. Jha, great to see you again. Thanks for coming back to the Sunday show. Just please, doctor, your reaction to listening to the Secretary of Health and Human Services push cod liver oil, vitamin A, and other things as a treatment for measles.
First of all, Jonathan, thanks for having me back. It's deeply disappointing, and let's just get right to what's happening here. I mean, cod liver oil was the standard of care for measles in the 1930s, 100 years ago, before we had vaccines. That is not the standard of care today. Now, vitamin A is an important thing, particularly in Africa or in other places where there's widespread deficiency. We use it, but it is not a real treatment for somebody who's otherwise healthy and has gotten measles. Jonathan, you and I both know there's only one way to prevent measles, and that is to get the vaccine. And if our health secretary should be talking every single day about the importance of vaccinations and making sure that everybody who's eligible gets a vaccine. Instead of that, he's distracting us with budesonide and cod liver oil and other things that really are not going to make a difference in preventing illness and saving lives.
How concerned are you? I think I just reported there have been 13 states have cases of measles. Are we looking at a runaway case of measles across the country, or do we still have the systems in place to slow it down or to keep it under control?
Well, it's going to vary from community to community. The reason we've seen such a massive outbreak in Texas is because in those communities, vaccine rates are very low. Let's be clear. This is the most contagious virus known to man, measles. And once immunity levels, vaccination levels fall below 95%, the virus is able to spread. You have communities with 80, 85% vaccination rates. They are very susceptible. If you have a community where, let's say, the vaccination rate is 95 or 98%, one case that comes in from the outside is not going to spread in any meaningful way. So I'm worried about places that have low vaccination rates. Obviously, Texas is one of them, Idaho, Alaska. There are many places in the country where we have seen very low vaccination rates. They might see very large outbreaks, and we've got to get on top of it because you're going to see a lot of kids and some adults getting very sick.
And what is the treatment for someone who's not vaccinated, who gets measles? Is the treatment easy, relatively fast, or is it not?
Look, there is no known treatment. We give vitamin A on the outside chance that they have vitamin A deficiency, but that's not going to help you if you don't have vitamin A deficiency. It's largely supportive care. A majority of people do okay, but we know in kids, 1 to 3 out of every 1,000 will go on to develop encephalitis. That is an inflammation of the brain. That is a very bad thing to have. About 1 in 1,000 kids end up dying from measles. There are other long-term effects of getting measles. It wipes out your immunity in a way that can be quite damaging. So there is, what we talk about is supportive care, just trying to get people through that infection. There is no known treatment for measles.
Let me get your thoughts on what I said at the beginning in the intro, that the CDC is planning to do a study on vaccines and autism, something that has been debunked many, many times. Why this obsession to find a link between the two?
Yeah, as you said, Jonathan, this has been studied thoroughly. It's been studied to death. And even Jay Bhattacharya, the new NIH director who's going to be coming in, agrees the science here is settled. What they're doing is by keep raising kind of doubts about vaccine safety and even launching this study, which is going to be a huge waste of money, they're going to be able to continue to say, well, we don't really know if there's a link. We're studying it, and continue to foment doubt. So to me, this is not an intellectually honest effort to get to the bottom of a question that has been already settled. I'm unconvinced that these guys are going to be persuaded by whatever this study finds. But for months and years, as this study goes on, they're going to continue to be able to question the safety of vaccines, causing more harm, more illness, and unfortunately more deaths for America's children.